everyone. Well, many people have trouble sleeping nowadays, especially during COVID times. Getting good quality sleep is one of the most important ways to stay healthy and vital. Chinese medicine has some interesting things to say about different type of insomnia. Let's take a look at how sleep works from Chinese medicine perspective. I am Amita from Nourish Doc, a platform for natural, holistic, and integrative therapies. Presenting this topic on sleep issues, we have Dr. Kai Peven, a naturopathic and Chinese medicine doctor. Dr. Peven focuses on each person's unique character to create the most effective protocol in order to restore health. Welcome, Dr. Peven.
Thank you for having me.
Great, so we will get started. Let's just start from what are the main reasons for insomnia?
So, there are so many. I wanted to put a few here. Probably the, sort of the modern factor that has the biggest impact is the amount of artificial light that we are now exposed to. This is totally unprecedented, the amount of light at night that we now have in our lives. And then, that's like really influences our circadian rhythms. When we no longer have a sort of regulated light dark cycle, that really is a big problem. And then, in addition to light pollution, there's noise pollution, especially for people that live in cities. Use of stimulating substances, coffee being probably the most well-known example. Stimulants keep you awake by definition, so that's going to cause issues. And then lifestyle factors, working too hard. People may have, had the experience where they're so tired they can't fall asleep. Stress, trauma. So, when trauma happens, typically a person's nervous system becomes hyper alert because trauma means that there's something dangerous. And even after the fact, the nervous system is on alert for danger. And if your brain and your body think that there's danger close by, then falling asleep is not a good idea, because falling asleep means losing awareness of your surroundings. And so that is actually a very big contributor to sleep issues. And then, other basic things like nutrition, how well we eat, underlying medical conditions, things that are, causing imbalance for other reasons. And then, sleep is also impacted. And, we could go on, but these are some, very common factors here. So, yeah, go ahead.
Yeah, no, I was just going to say, so let's talk about the Chinese medicine perspective.
So I have a few kind of patterns here. I want to just, give a brief overview of each one. They're kind of grouped into issues with qi, issues with yin and yang, issues with blood, issues around stagnation. For those of you that may be unfamiliar with the concept of qi, qi, I think, is best explained as the life energy. Qi is the distinction between someone that is alive and a dead body. It is the animating force to life. And I think, we can kind of leave it at that, just keep it simple. So the idea with qi is that, because it's the life force, it needs to move, it needs to flow, it needs to behave in certain ways. And with sleep, the sort of importance of the heart can't really be overstated. All sleep issues are heart issues. And in Chinese medicine, the heart is not just the muscle in your chest that, beats, once a second or once every 2 seconds, twice a second. And it's not all, it's, more than that. It's your entire cardiovascular system, all of your arteries and veins. It's also the physical kind of storehouse or container for your consciousness. And so sleep, because it involves changes in consciousness, always involves the heart. And you'll see that, you know, most of these patterns are heart patterns. So when the chi of the heart becomes agitated, this is kind of a state of hypervigilance. You know, often there are, you know, the mind is very active. There's a lot of thoughts happening. When it's mild, this is the classic case where it just takes a little longer to fall asleep because a person's mind doesn't shut down. So maybe, you know, it takes 30 minutes, or maybe it takes 60 minutes, or when it starts getting, you know, more extreme, then maybe it takes 2 hours or 3 hours. Or, you know, in the case of like very severe chi agitation, person might not sleep at all. And you see that in folks with bipolar disorders, who are sort of in manic episodes. They might just be up all night, not sleep at all. And you know, this is sort of typically accompanied by this sort of overactivity of the mind. That's really the main manifestation of this kind of agitation in the heart chi. When the heart chi becomes depleted, chi deficiency, then, you know, what happens is the person falls asleep okay, but they don't sleep very well. The sleep is very light. And so, you know, this is the kind of person that drifts in and out of sleep all night. There's not a lot of excess activity because the chi is deficient now, but there's difficulty like going into deep sleep. You don't just stay asleep very easily. Kind of, you know, waking light sleepers often end up with, you know, are sort of in this category. Another manifestation of heart chi deficiency is waking in the morning not feeling rested. So even if, you know, someone sleeps a full, you know, 8 hours, they wake up and they're tired, they're groggy, and you know, sort of, you know, sleep apnea, sort of common medical condition. I think, you know, a lot of people are aware of this. This is also can be a heart chi deficiency type of pattern, where the person isn't aware of waking frequently, but if you do a sleep study, you know, some people, they're waking up every 30 seconds because they stop breathing. And then when you wake up in the morning and you're awake and conscious, you're still very tired because you didn't sleep very well. Now we're sort of moving into the idea of yin deficiency. Yin is really the ability to store energy, to create potential energy. And that's what sleep is all about, is resting and rejuvenating. So when yin starts to become deficient, then there's really like the person starts losing the capacity to rejuvenate themselves. And primarily in what happens with sleep is this sleep becomes very restless. And so these are people that toss and turn all night. Often, you know, it might be because they're in pain and they feel uncomfortable, but if there's a lot of moving around, then, you know, that's kind of this yin deficiency pattern. Yin deficiency can also result in sweating at night, waking up with, you know, night sweats. And then the yang is sort of the root of our vitality. Yang is the motive force. It is, you know, active, purposeful. It allows us to be alive and move through the world. And when you have heart yang deficiency, now we're moving into actual like heart failure, according to, you know, sort of Western diagnosed heart failure. And, you know, these are people who typically, you know, maybe on the more mild side, there's swelling, like people whose ankles swell up at, you know, at the end of the day, and who like to sleep sitting up because when they sleep like totally flat, the fluid buildup starts to impinge on the lungs and they start to feel like they have a hard time breathing. All the way up to like actual sort of congestive heart failure, sort of diagnosed from a Western perspective. And then there are patterns that have to do with the blood. The blood is the source of nourishment for our bodies. You know, we sort of take in energy from the nutrients from digestion, and we combine that with oxygen from our lungs, and then we have blood that delivers all of these, you know, important factors to every cell. When the blood starts to become deficient, and for sleep, this is primarily around blood sugar, although, you know, you can also see this in people who actually have some anemia, especially women, right? But when blood sugar starts to get low easily, then what happens is the person wakes up in the middle of the night. So you go to sleep fine, you sleep, you know, 3-4 hours, and then you wake up, and it's usually, you know, around 3 in the morning. And this is because your blood sugar has dropped, and there's the liver, which is responsible for maintaining blood sugar, doesn't have the stores, the sugar stores in the organ to keep blood sugar stable. And so you get a little bit of adrenaline and stress hormone from the kidneys, from the kidney adrenals. And that stimulates the liver to make sugar, because it ran out of stored sugar. But you know, that little bit of adrenaline and stress hormone, cortisol, wakes you up. And so you wake up. I'm going to skip to the heart blood stagnation, just because we're talking about blood. With blood stagnation, blood stasis, there's an impairment in the circulation, and this is typically at a capillary level. I think from a biomedical perspective, we're talking about inhibited circulation in the tiny, tiny capillaries of the brain and also of the gut. So there's an inhibition of this gut-brain connection, and it has to do with circulation. And these are folks that wake up in the middle of the night in a similar way to the blood deficiency picture, but they wake up and they can't go back to sleep. And it might take 30 minutes. It might take, you know, 2 or 3 hours. You know, people who are awake for 2 to 3 hours in the middle of the night because they wake up and can't fall back asleep. That's a blood stagnation kind of picture. For heart chi stagnation, this is, you know, you get some of the chi type patterns. This can be people who wake up in a panic. So sometimes, you know, if you have a you know, disturbing dream, or even without a dream, you know, you sort of wake up like with a rush of adrenaline or with a sort of anxiety attack, like straight out of sleep. That can be a chi stagnation kind of pattern, and that's almost always related to some kind of trauma. And of course, you know, the trauma can happen very early in life and not be conscious. So, you know, just because a person can't remember anything traumatic happening doesn't mean that it didn't impact them sometime in their past. And then, you know, with the food and digestion, if digestion is working hard, it will be difficult to sleep, because digestion is still, even though it's inside the body, it's actively. Yeah.
Your voice was breaking up a bit. I don't know. I couldn't hear you for some reason. Just the last sentence, if you can repeat, please.
I was just talking about digestion and how digestion is an activity, even though it's happening inside the body. And so when the body is active, then it's harder to sleep, because sleep is a time of rest and recovery. And so, you know, this often happens when people have weak digestions, and especially if people are eating larger meals later in the evening. You know, people who experience heartburn or reflux if they eat too close to bedtime, this ends up being more of a digestive issue, as opposed to, like, you know, sort of the rest of the patterns that are about the heart. And then, you know, with all of these patterns, and, you know, a person can have more than one pattern. These are, you know, just guidelines to understand what might be happening. If you have what's called phlegm misting the orifices, so for instance, if you eat close, you know, if your digestion is not good, then you can have phlegm coming from the digestive system due to a lack of digestive fire to burn up your food cleanly, you might say. That can come up and obscure the heart. It sort of gets in the way of the heart's ability for clear consciousness. And this tends to lead to more intense or more severe mental health issues. And so you can have, any of these symptoms, but with the added kind of, severity of mental health problems. And, many folks that are dealing with mental health issues are also going to be suffering from various types of insomnia. So that's very common. So that's kind of
should we move on to a case study and then we can open it up for questions after that?
Yeah, let's take a quick look. So yeah, go ahead and let's move to the next slide.
All right, we are here.
I don't see it, but okay. There we go. So this was a recent patient I had, 44-year-old male patient, came in primarily for wellness. Didn't have a lot of issues. His partner had decided to come see me and wanted him to kind of come and just get a checkup, basically, work on some things, but nothing severe. But then I found out that he hasn't slept very well in a very long time. He worked in Alaska on crab fishing boats decades ago, and since that time, he would he was told by his crewmates that even while he was sleeping, he would continue to work, and so he would take things apart and throw things around the room in his sleep, and that kind of sort of sleep behavior, being active while sleeping, has partially continued. He will wake up 3 or 4 times a night and have to go around the house and check on everything, which he attributed to when his kids were young, needing to check on them, make sure they were okay. But even though now they're, even when they're not necessarily at his house, he has to get up and walk around. And he also gets very hungry in the evenings and at night, and will often get, in the middle of the night when he's up, he'll eat something, he'll have a snack. And every once in a while, he'll wake up in the morning and, see evidence that he ate something, but not always remember that he had, had that snack. So a little bit of, sleep eating as well. So this is partly, when we were talking about the patterns, there's absolutely some sort of agitation of the heart qi. And this agitation is coming from the stomach. So, there's an element of the sort of food stagnation that I was talking about, but the stomach actually, and by stomach in Chinese medicine, I really mean the entire digestive system, the gut as a sort of functional organ network, which includes the blood flow to the gut. It includes what's called the enteric nervous system, which is our gut brain. It includes all of the hormones and digestive enzymes that are secreted, stomach acid. So the stomach is a really major organ. And you can see that the stomach's impacted because he's hungry at night, right? That's a stomach function, is to be hungry. And so the stomach is hungry, it's active, and that, being active is impacting the heart's ability to rest and to be, bring that sort of heart consciousness into the body so that it's not, functioning externally in the world anymore. So we did acupuncture treatment, and I gave him a herbal formula. I prescribe herbal formulas in tincture form, and I do low dose. So typically I have patients take a few drops at a time, 2 to 3 times a day. And this was a tincture that focused on exactly this type of pattern, where the stomach is overactive and therefore impacting the sort of ability of the heart to manage consciousness effectively. So next slide. So I saw him 2 weeks later, and I found out that he is now waking once per night. And sometimes he's sleeping all the way through. He was sleeping, he was waking up 3 to 4 times a night. And now there's nights where he's like sleeping all the way through, which is really incredible. I was not expecting, this kind of result, but I was very happy about it. He's not, and when he does wake up, he doesn't have to get up and walk around the house and check on everything. He just wakes up and then he goes back to sleep. And he's not as hungry in the evening. So, and this, 2 weeks time was very fast. So this was really amazing. And I was, we were both very happy about this. I think something else that I had mentioned is that he has a lot of very vivid dreams, and these had also calmed down a little bit. His dreams were not as, not as intense as they used to be. And that's good, because when dreams are too intense, then, a person is using energy in their dreams, and sleep is supposed to be restorative. So, some dreams, of course, are necessary and appropriate, but if you spend too much energy dreaming, then you're not gonna, you have less energy when you wake up in the morning. So I think that was, a very good result. Of course, there are other things we're still working on, but in terms of sleep, that turned out very well.
That's great. So you said within 2 weeks, how many acupuncture sessions did he have to take?
So that result was with only a single acupuncture treatment, and then 2 weeks, 2 weeks of a daily, low dose herbal formula.
Okay. So that's very, very effective, considering that it happened very quickly. We have audience participants. If you have any questions, please open it up. We are open for questions right now. I do see attendees. So if you have any questions, please let us know right now. How did you figure out, let's talk a little bit about the treatment and your diagnosis a little bit for our viewers. How did you diagnose? Like you mentioned earlier, it was a stomach kind of a chi that was a problem. So you use the same kind of a principle as you explained earlier in the slide?
So, primarily I diagnose with, symptoms, right? What the patient is self-reporting. And then also I do a lot of pulse diagnosis. So the pulse is able to tell me a lot about what's going on. And, again, like the fact that he's hungry and, waking up to eat in the middle of the night is kind of the key point here. And, along with sort of his overall character and personality, definitely, points towards sort of overactivity in the stomach.
And then a lot of people also wake up at night, to go to the bathroom. So do you think they also have a sleep problem, or it is just the body just goes through a system and then you have to go to the bathroom? I mean, can we talk a little bit about that?
Yeah, absolutely. One of the, I think a key aspect of waking up at night in order to, because you need to go to the bathroom, is to recognize how the bladder is controlled. So generally speaking, the bladder has plenty of capacity for a person to go all night without having to get up. But the signal that the bladder is full and needs to be emptied is connected to the sympathetic nervous system. which is our fight or flight response. And you see this in sort of the extreme cases when fight or flight is triggered and a person, has a lot of that nervous system arousal, right? They become very, they become ready to fight. They become ready to run away. That's typically associated with fear. And when it gets really extreme, people will lose control of their bladders. And so there is a connection between the nervous system being on alert and the need to, get up and use a bathroom. So that's one reason that people find themselves waking up, is there's sort of this level of alertness in the nervous system, which is not calming down at night. And, that's often from stress, because, the body is sort of living in an environment where things are dangerous, things need to be done. There's a stress happening. So that's one big reason. As people get older, older folks who have to get up at night to go to the bathroom, that can be more of a sort of weakness of the kidney adrenal system, where the kidneys, in Chinese medicine, you would say the kidneys aren't holding well. They're not storing and sort of holding the fluids of the body. You see a connection biomedically with the regulation of adrenal hormones that control fluid metabolism. So the adrenals secrete hormones that tell the brain, and therefore also tell the kidneys how much urine to produce and how much fluid to retain in the body. So when those hormone levels get low, or when neurons in the brain aren't well regulated, you can have less of that. It's called antidiuretic hormone or vasopressin. You have less of that hormone, and then the kidneys are producing more urine when they should really be kind of keeping more fluids in the body at night, because you go many hours without eating or drinking, without replenishing yourself. So I would say those are the two kind of major patterns. Of course, there's plenty of others, like if you have an infection, that's going to influence things, but for kind of regular long-term issues, tends to be, I tend to see those two things going on.
Can you hear me?
I can hear you now.
Okay. Any questions from the viewers? Dr. Kai is live with us from Seattle. So any questions from the audience? All right, I do see a question. Let me just, before I stop share, you can reach us at, I've written our email here, I've written our WhatsApp number, give us the feedback, what about the session. So let me just take care of a few questions. All right. What type of posture is best for healthy sleep? That's a question from the audience.
Yeah, good question. So I don't think there is a best posture. Traditionally people sleep in all types of positions. And this is going to be very individual. People's bodies are shaped differently. People are going to, prefer to sleep on different types of surfaces. Sleeping on the back is I think relatively new. If you examine or you look at traditional cultures where people slept directly on the ground, most of the time people slept on their sides. And there's certainly a debate about whether that's better, whether that's worse. It's also going to depend on what a person might be experiencing. People who snore or with mild sleep apnea will often find that sleeping on their back makes that worse. And so, side sleeping or sleeping on the stomach might be better for those people. People with chronic pain issues, sleep position is often an important factor, like finding a good sleep position. So yeah, I don't think there is a single position that is best. Primarily, the best position is the position that feels best for that person, and allows them to be as relaxed as possible. I think there's so much individuality. How many pillows a person uses, if a person puts a pillow between their legs, if they're on their side, if they're on their back. I mean, all of that is fine. Primarily, if you wake up, if you sleep well and you wake up feeling good, then that position is the right one for you.
Sure. And there's a lot of research, right, for on acupuncture helping with the sleep. That at least that's what I was looking it up. So do you want to talk a little? That acupuncture helps with the sleep overall sleep.
Yeah, I've seen a few studies, examining acupuncture and sort of sleep quality. I don't think, I haven't seen any. I'm not aware of any studies trying to bring more detail to that question. Looking at specific, types of sleep disorders. Whether there may be studies out there, but I have not seen them looking at acupuncture for diagnosed sleep disorders such as sleep apnea. But acupuncture is good for, I like to say acupuncture is good for everything that the body has the capacity to change on its own.
That's great.
Yes. And so, if something is beyond the ability of the body to change, then acupuncture is not going to be very effective because it relies on the body's own healing abilities. But
okay,
yeah,
no, that's really good. Any other questions before we wrap up? Okay. All right. Well, thank you so much for joining us, Dr. Kai. Would you like to say something as a final comment before we wrap up?
Perhaps I should mention that I recently wrote a book on sleep called Natural Remedies for Sleep. And it is sort of in the final editing phases and is slated to be published in October. So kind of look for that. And there's a lot of really, detailed interventions and techniques across the spectrum from, meditation to essential oils to, acupressure points. So yeah, I think, if you're interested in this topic, then, keep an eye out for that book.
Great. Yeah, we've had yoga teachers come on the platform as well, talking about different type of breathing exercises that that has correlation, and some research on yoga, like you said, on oils, and there's so many different things that one can do. But this specific topic today was on acupuncture. We have another question from the audience. They say many people used to sleep at day, and they don't sleep at night. How this changes the mentality?
So I'm going to take this sort of as referring to the people who have a sort of flipped sleep cycle, meaning, they stay up all night, they sleep during the day. I think, again, primarily, this has to do with the exposure to artificial light. And in that sense, it's really reflective of a larger imbalance in our society as a whole. One of my mentors talks about this kind of flipped sleep cycle and relates it to a deficiency or decline of the kidney essence, kidney jing. And the essence is, you could say, it's constitutional vigor. So, this essence is seen primarily in the Constitution. And many people in modern times have less of this. You see it physically in strong bone structure, symmetrical features, wide jaws, wide cheekbones, evidence of healthy nutrition in the mother when she was pregnant. You see this kind of strong essence in people who are resilient, who are able to work hard without, without becoming debilitated. People who are able to sleep 5 hours a night and don't seem to suffer any ill effects. People whose nervous systems are strong, they can take stress and trauma and not be as, not be thrown off balance, as much as other people who are more sensitive. All of these sorts of things are reflective of this sort of strength of constitution. And not being able to regulate oneself with respect to the environment is a form of sensitivity. And, we see that also more and more, people who are removed from nature, people who, are up all night and sleep all day, they're not out, they're not out in the world. They're often, living in very artificial environments, living in the middle of cities, behind screens a lot, in environments that are separated from, the natural world. And so I think it's definitely a serious problem. And I could get into other situations for evidence of this sort of decline of the kidney essence, fertility being a big one.
Yes.
It's a big topic.
That's right. Very, very big topic for today's session. I was just going to comment that we had an expert on Ayurveda, and they were saying the same thing what you just said, that with that, we'd like to wrap up this session. I would like to thank you, Dr. Kai, for coming this evening. Thank you so much. And for the audience, you know how to reach us. Please let us know your feedback, what you like about the session, what you like to see new topics. Please let us know. Thank you so much. Signing off, this is Amita. Thank you, Dr. Kai.
Thank you for having me.